Hi, I'm Dave, and I have skin cancer, and it's melanoma. It's the type that can spread. The type you want is basal cell, which doesn't spread, and it's really easy to take out and stitch it up, and you're good. But I have melanoma, and so I thought I'd do this recording and just see how it goes, and hopefully it might be helpful to somebody that's kind of curious about what happens. I have it on my nose, and you can probably see it there. I have some stitches right here. And it's about 3.5 weeks ago, the surgeon took quite a chunk out of my nose and had it tested. And so we know it's melanoma. Um, in 3 days, I'm going to have my surgery. And so we're going to take quite a big piece out of there and then replace that with a skin graft, probably from my neck, I'm told. And then we'll probably have a follow-up operation at some time. There might be some restructuring maybe next year, depending on how it all works out. So um, that should go pretty well. There's a second option, and the surgeon's actually leaning towards this option, which I'm not too comfortable with. They take a big strip out of your forehead. It's going to be like this big, about an inch wide. They flip it over and attach it to your nose, and then that strip actually stays there for about 4 weeks, and so it's live skin and it heals quite nicely. And then in about 3 or 4 weeks, they cut it off and redo a little bit of stitching, and away you go. Uh, Boy, if you look at the pictures on Google, it's a scary operation. I'm not too sure that I want to go that route. Um, I'm going to have a one last talk with my surgeon in 2 days, and we'll see how big this. If this is going to be less than a centimeter and a half, then I'll definitely go with the skin graft. But it probably will be slightly. I'm thinking probably 2 centimeters. Still kind of leaning towards the skin graft. Uh, I don't know. Secondly, when the operation takes place, we want to find out if the cancer has spread. My surgeon says it probably hasn't. So what they have to do is take out a couple lymph nodes. Apparently, in years past, they take out 20 lymph nodes and just to make sure they check them all. But now we're talking about one or two. And about 3 weeks ago, we put 3 needles into my nose with blue dye and then took x-rays and a CAT scan to find out where the closest lymph node is. And I'm told it's probably, I don't know for sure yet, but it's probably somewhere in here. So that means they'll open that up, probably remove some muscle tissue, and then get down to the lymph nodes and remove one or two lymph nodes, and then sew that back up. And we'll have it tested. Unfortunately, it's a slow process, so I still have about 2 weeks, and we'll find out if it's spread. And somehow I think although I did have a sore nose for 2 or 3 months before I finally was wise enough to ask the doctors what the heck's going on here. And he said right away, oh, that's skin cancer. And so then we found out it was melanoma, and this is where we're at now. So that's what's happening, and I'm looking forward to Friday in a few days now, and get this operation over with, and we'll take it from there. And I'll keep you up to date, and I hope this is helpful, and we'll let you know of my progress. Thanks. Have a good day, and don't forget, wear your sunscreen.